Before you place that drop in your eye tonight, there is something you need to understand, because almost no one is told it. The small bottle sitting on your bathroom shelf, the one you have been using once every evening, is quietly changing your eyes in ways your doctor may never have mentioned. Not damaging them, changing them. And when those changes appear, most people panic, stop the medicine, and make the one mistake that can cost them their sight. I am Dr. Hiroshi Nakamura, and after more than 20 years caring for older adults and their eyes, I have lost count of how many patients have sat across from me, frightened, holding this very bottle, certain that something had gone terribly wrong. In almost every case, nothing had gone wrong. They simply had never been told what to expect, and that lack of a single conversation nearly cost several of them the very vision the medicine was protecting. So let me give you the conversation you should have been given on the day this was first prescribed. Latanoprost is one of the most widely used eye medicines in the world. If you have been told you have glaucoma or even slightly raised pressure inside the eye, there is a very good chance this is what you were given. What it does is simple and remarkable. The pressure inside your eye, when it stays too high, slowly presses on the optic nerve, the cable that carries sight from your eye to your brain. Over years, that pressure damages the nerve so gently that you feel nothing at all, until one day the edges of your vision are gone and they never return. Latanoprost lowers that pressure. It opens a natural drainage pathway inside the eye and lets the fluid escape, easing the burden on the nerve. Used correctly, it is one of the finest tools we have for protecting sight. Let me explain how it actually works, because understanding this makes everything else make sense. Inside your eye, a clear fluid is produced all day long, and it must drain away at the same rate it is made. The way a sink with the tap running stays level only if the drain keeps up. In many older eyes, that drain becomes sluggish. The fluid builds, the pressure rises, and the nerve pays the price. Latanoprost does not force the fluid out. Instead, it gently relaxes and remodels the tissue at the back exit of the eye, opening a secondary pathway so the fluid can seep out more freely. It is a slow biological change, not a forceful one. And this is the key to everything I am about to tell you, because the same gentle tissue change that protects your sight also produces visible effects elsewhere. Stay with me, because understanding these changes is what separates a frightened patient from a protected one. The first change is the color of your eye. Latanoprost can slowly increase the brown pigment in the colored part of the eye, the iris. If your eyes are blue, green, or hazel, you may notice over many months that they begin to turn a little browner, often one eye more than the other. This is permanent. It does not hurt you, it does not affect your sight, and it does not mean the medicine is harming you. But imagine looking in the mirror after a lifetime of blue eyes and seeing them change, with no one ever having told you it might happen. That is the moment many people quietly stop their drops in fear. That fear is the real danger, not the color. The second change is your eyelashes. This medicine can make the lashes on the treated eye grow longer, thicker, and darker. Some people are delighted by this. Others are confused, especially when it happens to only one side and the two eyes no longer match in the mirror. Again, this is harmless. It is simply the same tissue effect working on the small follicles of the lash line. I have had patients return convinced something was wrong with one eye, when in truth that eye simply had fuller lashes than its partner. The third change is the skin around the eye. Over time, latanoprost can darken the skin of the eyelid slightly, and in some people it can cause the small fat pads behind the eye to shrink, so the eye looks a little more sunken or hollow. This is the change that surprises people the most, because they never imagine an eye drop could alter the shape of the face around the eye. It is usually subtle, it usually affects only the treated side, and in most people it slowly reverses if the medicine is ever changed by your doctor. The fourth thing I want you to understand is about timing, and this is where the medicine quietly fails for so many people without anyone realizing it. Latanoprost is meant to be used in the evening, once a day, and only once. Many of my patients believe that if one drop is good, two must be better. So they place a second drop, certain they are helping themselves. But the eye can only hold a fraction of a single drop. The second simply spills onto the cheek, or washes the first one away before it has absorbed. Worse, using it more than once a day can actually make it work less well over time, while increasing every one of the visible changes I just described. More is not better here. One drop in the evening is the entire instruction, and it matters more than most people realize. The fifth thing is not a change, but a feeling. When you first begin, your eyes may sting briefly, feel a little gritty, or looks slightly red after each dose. For most people, this fades within the first few weeks as the eye adjusts. It is not an allergy and not a sign of harm in the great majority of cases. It is simply your eye becoming accustomed to the medicine. Knowing this in advance keeps you from abandoning a good treatment in its very first month, which is exactly when many people give up. If you are using Latanoprost right now and you have noticed any of these things, write the word yes in the comments below. I want to understand how many of you were sent home without anyone explaining a single one of them. I read every comment, and your answer helps me know what people are never being told. Let me tell you about a patient. I will call her Margaret, 68 years old, a retired school teacher, precise and observant, the kind of woman who noticed everything. She had used Latanoprost for nearly a year when she came to me deeply upset. One of her blue eyes had begun to turn brown, and her lashes on that side had grown long and dark, while the other side stayed exactly the same. She was convinced the medicine was poisoning her, and she confessed, almost in a whisper, that she had already stopped using it 3 weeks earlier. What frightened me was not the color of her eye. It was that in those 3 weeks, without her drops, the pressure inside her eye had climbed back to a dangerous level, silently, painlessly, already pressing on a nerve that had no more damage to spare. Margaret had stopped a sight-saving medicine over a cosmetic change that could not hurt her at all. We restarted her treatment that same day, her pressure came back down over the following weeks, and her vision was preserved. But had she waited only a few months more, the loss would have been permanent, and no medicine on earth could have brought it back. The medicine never threatened her sight. Her fear, born from a missing conversation, very nearly did. When I explained to her gently what each change meant, I watched the fear drain out of her face. She told me later that what she had needed all along was not a different medicine. It was simply to understand the ones she already had. So here's what I want you to take from this, and I want it to be very clear. If you notice your eye color changing, your lashes growing, or the skin around your eye darkening, do not stop the medicine on your own. None of those changes can harm your vision. The disease, left untreated, absolutely can. There is the entire decision in a single sentence. Now let me give you the small, practical steps that protect you, the ones Margaret was never taught. After you place your one drop in the evening, close your eyes gently, do not squeeze and do not blink hard, and press one fingertip lightly on the inner corner of your eye beside your nose. Hold it there and count slowly to 60. That gentle pressure closes the tiny drain in the corner of your eye, keeps the medicine where it belongs, and stops it from running down into your bloodstream, which reduces effects on the rest of your body and helps the drop do its real work. One drop, eyes softly closed, finger on the corner, 60 seconds. Use only that one drop in the evening, never more. To protect the skin around your eye, gently wipe away any extra medicine from the eyelid with a clean tissue after each dose. And never let the tip of the bottle touch your eye or your lashes, because that contact can carry infection into an eye that is already vulnerable. These steps cost you 1 minute a night, and that minute may protect your sight more than any change in dosage ever could. I want to be very clear with you about something. I am not telling you that Latanoprost is dangerous, and I am never telling you to stop it. This medicine protects sight every single day for millions of people, and it may be doing exactly that for you right now, while you feel nothing at all. What I am telling you is that you deserve to know what to expect, so that a harmless change in the mirror never frightens you into abandoning the one thing standing between you and the slow loss of your vision. Your eyes, even later in life, respond well when you give them steady, correct care. Margaret is proof of that. Nothing about her medicine changed, only her understanding changed, and that understanding saved her sight. You are not powerless here. Knowing what is normal and what is truly worth a phone call to your doctor puts the control back in your own hands, where it belongs. If anything ever does concern you, a sudden change, real pain, light that suddenly hurts your eyes, or vision that clearly worsens, do not guess and do not stop on your own. Call your eye doctor and describe exactly what you see. That single phone call is always the right choice over silence or fear. The people who keep their sight the longest are not the ones who never worry. They are the ones who ask, instead of guessing alone. If this helped you understand your own medicine a little better, please subscribe and give this video a like, so that other people holding the same bottle, just as worried as Margaret was, can find the answer too. I will keep sharing what I see in my patients, so you can make calmer, wiser decisions earlier, while those decisions still matter most. And tell me below, How long have you been using Latanoprost, and did anyone ever explain these changes to you? I read every single one.